ready for this session on empathy and the doctor, how to be a holistic doctor. Now, my name is Brian Lariche, and what would be my background to be able to talk about this? Besides being a trainer for many years and dealing with many people, I used to work with the United Nations, and I used to do work related to HIV/AIDS. And during that time, that was the start of the pandemic in the 90s, those days. Yeah. So I had a very strong background in dealing with people who were HIV positive those days, though it's strictly not from a medical point of view, but more from an empathy point of view, dealing with the community. And nowadays, I do community service, so I'm quite familiar with the issue of dealing with community. Plus, I myself have a fair amount of experience being in hospital. So I'm going to share with you some points that, first of all, deal with the practicality of being a doctor, a holistic doctor. And number two, the reality of being a doctor in skewed more towards the government service here, not so much towards the private sector. And I'm going to, what I've also done is, normally I don't have such heavy slides, but this time I'm going to start with I'm going to provide you with the slides that you can then refer to, as your reference points. So, yeah, me over there, and yeah, how to be a holistic and empathetic doctor. Empathetic, sorry, not emphatic. My typo, that one, empathetic doctor. Now we're going to talk about a lot about empathy and sympathy, and I think we need to understand this very clearly. I don't know how much of your module in your university you do on this issue of bedside manner, but for me, bringing in personal experience and years of working with the community that have been diagnosed with illnesses, I find that is unfortunately sometimes lacking in our young doctors when they go out into the field. And I think it is something you need to really take cognizance of, really pay attention to. And I must say, the two IMU doctors that I met when I was in hospital, in University Hospital, showed very impressive bedside manner and empathy. And I hope the same of all of you. But at the same time, I've also met very young doctors who are doing their rounds, who are doing their housemanship at the hospital that left much to be desired. Yeah. So now, empathy. What is empathy actually? It's the ability to understand one emotional state, and I think sometimes, very frequently, it's mixed up with sympathy. Now, sympathy is concerned about someone's emotion, while empathy is the understanding of someone's emotion. But we have to be a bit cautious here. One of the worst things you can say is, I understand how you feel. Actually, many of us don't understand how you feel, or how I feel, or you feel, or we feel. We can imagine, and we have to be very careful not to use this word so generously. I know how you feel. I know how you feel. Actually, you don't know how I feel. You can only imagine how I feel, or I've gone through a similar process, so I think I know a little bit about how you feel. That would be the proper way of putting it down. Don't be too cocky to the point that you are very sure of. We can never know how somebody else feels. Yeah. To be clear, empathy is not sympathy. Sympathy is feeling pity, and I always tell somebody, sympathy is dealing with your own emotions. Right? Sympathy is feeling sorry for somebody. It doesn't do anything for the person on the other side, right? In fact, it feeds them sort of negative energy to some degree, while empathy is more of understanding their condition and reacting to that understanding. So how you react to somebody's condition is empathy, right? So please remember that. So here, very clearly, empathy is, I feel your pain, while sympathy is, I'm sorry that you're in pain. Right? Two completely different things. So when I feel you're in pain, I usually act upon that and see what I can do to alleviate your pain. And this is what we are looking at in today's session, about how can you alleviate the pain of your patients? How can you make the patient feel more comfortable? How can you be a better doctor, a more holistic doctor, when you deal with your patients on a day-to-day basis? Okay. But please also remember, you look at this iceberg here, IQ and EQ. IQ is your intelligent quotient, while EQ is your emotional quotient. And please don't underestimate your emotional quotient. Again, I spent altogether now, if you put in the 3 times I was in hospital, 7-8 weeks, plus another 4 weeks, plus another 1 week. So altogether, I was in hospital a total of 13 weeks over 2 years. And I have a lot of experience sitting down in the hospital every day, feeling sorry for myself, feeling depressed, feeling happy, all the whole gamut of reactions I had. And I think we need to be clear on this, and don't when I talk about empathy, don't oversell it, right? I mean, it's there for a purpose to try to push you to understand the patient's feelings better, so that when you understand the patient's feelings better, you'll be able to react to the patient better, right? It's not just a one-off meeting and suddenly some of us are blessed. Some of us are blessed with a very strong emotional quotient within ourselves that we can sense and feel people's feelings to better. And some of us have no ability at all. And I've seen that in the doctors that come to see me, not only the houseman, but also the MO, right? And I think there's something that we need to understand. Now, I put down here the three distinct types of empathy: cognitive, emotional, and compassionate. I'm not going to go too deeply into that. This is not a class about empathy in itself, but more a practical session for you to be able to take something and go. I'm a strong believer in reality and the practicality of life. So what I suggest you do is you take a little bit of time to understand what is cognitive empathy, what is emotional empathy, right? And what is compassionate empathy, and how it would work for you, and understanding your capacity for each type of empathy, and which how the empathy can work within your sphere as a houseman, as a doctor, as an MO, as a what do you call it, consultant doctor in times to come, right? All this will be shared with you anyway. This whole recording will be shared with you. Now, for me, the way a doctor treats, as much as the medicine is good, right? The doctor needs to understand the patient better, because at the end of the day, only the patient knows his or her body well. So to be able to, the doctor can only give in so much of input, because if the patient doesn't tell everything that's wrong with him or herself, you'll never be able to diagnose the patient better, right? So it's good to create the bond, to be able to understand, to make the patient feel comfortable enough from the beginning to be able to talk to you. That's why your bedside manner, and I always tell my students, be it my students at university where I teach, or people like you who I'm giving a session on empathy, that you can only make a first impression once. Now imagine if you are admitted, you don't know what's going on with you, you are in the hospital and you're feeling a little bit down, and then this houseman comes to you and starts to poke around with you, starts to inject the needle without even talking to you, and this saying this a brief hello and then goes to work. There's no connection at all. It's not like I'm blind. I understand all government hospitals have a long line of patients for you to fill, for you to take care of. But there's no point doing a half-hearted job. If you want to do something, do it well, and you will find at the end of the day your stress levels will go down, right? And when your stress level goes down, the stress level or the emotional state of the patient is much better. So, take a little bit of time. You can make a first impression only once. So when you first meet a patient, talk to the patient. I'm going to go through shortly about the steps you need to do in your introduction when you meet the patient for the first time. Okay. Please remember that it's not always possible to genuinely empathize with every patient. It can be emotionally draining. You can't be sitting down and spending 25 minutes finding out the family background of every patient sitting in the beds, in a whole ward of 25 beds, and then you spend 1 hour with each. There's not enough time in a day. You also, to some degree, have to have a clinical detachment, because you'll be an emotional basket case if every patient you get to know passes away, or gets into a deeper medical condition, because then life seems so helpless. What do you do? What are you contributing as a doctor? So we have to balance that, and only you yourself as a person, as you get to know yourself better, can understand that balance of empathy that you need to have when you deal with the patient. Please remember the oxygen principle that you have when you're working in, when we're in the airplane. They always say when turbulence happens and the oxygen mask falls down, the first thing you do is to give the oxygen mask to yourself before you help your older father or mother or younger child with you, right? Because if you can't help yourself, you can't help anybody else. So it's very important to have some self-care and because being a doctor is no easy thing. There's so many emotions. You're dealing with people's lives, not only the life of the patient, but the life of the family and the extended family that you will see every time you meet. It's important to know this balance, and part of this balance is, of course, being a good listener. And please, remember this, this one adage: please listen to understand, not listen to answer. What we always do very often is we listen so that we can very quickly and glibly answer a patient very quickly. That's not the point of listening. We are listening so that we understand the nuances, the hidden story. What is the background of the patient, to give a deeper understanding of the patient. Just trying to understand, listen so that you can just very quickly finish the patient and send him or her off. It's not the best thing to do. Yeah. Now, I want you to read this, right? This simple, what you call it, example, analyze here. It goes to show about the bedside manner. It goes to show about the bedside manner. I'm not going to talk about the doctor. I'm going to give you another example. I had a insurance agent who came to see me when I was 21. This was about 25, 30 years ago. And he wanted to sell me insurance. And as he was trying to sell me insurance, he kept saying the same thing: when you die, when you die, when you die, right? This is what's going to happen to you. Now, when I'm dead, I'm gone. I'm 21. When I'm 21, I believe I'm going to live forever, right? I was not married at that time. Who was I thinking of leaving my wealth and my millions to? So, I didn't see any reasoning behind what he was trying to tell me. He didn't make any eye contact with me. He kept trying to tell me about the future, which I couldn't recognize. I couldn't connect with. And the same thing here with the orthopedist who's talking and giving a diagnosis to the patient. It's very important you connect when you're talking to the patient and explaining to them what's wrong with the patient, right? So please remember this, that connectivity, and be current, be real, be mindful of the situation when you're talking to a patient. Okay, so how do you go about doing this? How do you go about doing this, in a practical manner? So you go, hi, my name is Brian Lariche. If you're wondering why my name is Lariche, you make a little story out of it. If not, you can just say, my name is what do you call it? Tan Etiquette, but you can call me Tan, or you can call me Alan, whatever, you know what I mean? And then explain, I am a houseman, I am an MO, I'm the, what do you call it? Hopefully by then, if you are already a consultant, that you don't need to be listening to me about this. But yeah, explain to them who you are in the pecking order, and what you can and cannot do. So Brian, I'm the houseman here. I'll be in charge of the day-to-day management for you. But when it comes to your medication and all these things, I always have to seek the advice of the MO. I cannot make the decision. So explain your position, explain who you are, what you can and cannot do, right? And when you will and will not do, right? And then you need to estimate your patient's intellect. Is your patient a 67-year-old, uneducated, what they call it, low-level government servant who can speak, but obviously he doesn't have the medical background or doesn't have the educational background to be able to understand deeply, right? So, but don't also underestimate that there are some people who started small but have a high personal capacity to read and write. For me personally, I never understand when the houseman comes to me and says, uncle. I don't like being called uncle by anyone except my own nephews and nieces. So, ask and see. I know it's Malaysian culture, everyone is uncle and auntie. Why don't you ask them? So my name is Brian. I'm the MO, what do you call it, the houseman. What can I call you, sir or madam? Do you want me to call you madam? Do you want me to call you Mrs.? Do you want me to call you auntie? Which are you comfortable with? Can I call you auntie, please? Are you comfortable with that, Auntie Tan? Or Auntie Zainab, or Auntie Lila, whatever, looking at their name, and then it makes it easier for you. And when you're a little bit friendly, they will relax immediately and open up to you. Okay, so and don't talk down to them. Really, I found it very irritating. The university hospital is a teaching hospital, so every time, because I could speak English well, the consultants and the MOs used to bring loads of students around, and because I was bored, I allowed them to come. But in the beginning, they really acted like I was a piece of wood sitting there as they would talk over me, highlighting how silly I was and in not controlling my medical issues. And I felt really stupid. So in the end, I had to tell them, if you keep talking like this in front of me, to young people next to me who could be my students myself, then I'm not going to allow you to do this anymore already, right? And then they apologized and they went, and it was very pleasant after that. So please Remember that the condition of the patient is very important. Spending an extra 3 minutes in the beginning to talk to your patient, to establish that rapport and understand who you are is very important, right? And I want to digress a little bit also. Please also remember how you dress is also very important. I remember when in hospital there were some who they didn't overdress. For one, I don't see any value in you wearing a tie if you're a doctor walking around in the hospital. Look relaxed, look comfortable, but look professional. And this is very important. If you look, especially if you're physically very small or you look very young, you are blessed with the to look forever young. You're 25 and you look like you're 15. Then the older people are going to look at you and say, oh my God, this is a child trying to treat me. Then you lose the respect. So you need to dress up or dress down according to your physicality, wear colors that make you feel good, wear colors that make you feel confident, and always the most important thing is to be neat and smart, right? This is very important. The sloppy doctor is not the good doctor, right? Extremely important. I know I'm digressing a little bit, but this is part of your relations because the patient can only, identify with what they hear from you and of course what they see from you, right? And the third thing is also be very careful on how you speak, right? When I'm sitting now in the hospital in the ward, I can hear everything. And I can hear the houseman going, ayo, tak tahu lah macam mana dia punya darah, and then, it just went on and on and on. And, don't share your anxiety of the patient in front of the patient. So be very, very careful with that, right? So, again, don't talk down to the patient. Ask the patient what they're comfortable with. Some of them may be veterans going to the hospital over and over and over again, especially the orthopedic ward. So get used to it, and then they think they know more than you. So you have to balance that depending on the ward that you're in, right? Depending on the ward that you're in. So number one, the basic thing, introducing yourself, getting to know the patient is very important. Next, okay, listen to the patient. I remember being in the orthopedic ward and having 2-3 other people who, like me, were diabetic. And despite all the medication given, the patient's blood sugar level was still at 16, 18, 20. What they didn't tell the doctor was there was a push cart being pushed every day, and they would get out of bed, go and buy, the kueh, nyonya, and eat all these kuehs while in the hospital, by the way. All their family members would come over with the big teh tarik, as sweet as ever, and with the burger for them to eat from McDonald's. So, if when the doctor asked them, did you eat anything outside the daily diet here? No, but it was not true. They were lying, right? So, listen carefully. When they're comfortable with you, they'll tell you the truth. Oh, tadi saya makan McDonald's, and only then you'll be able to understand what's going on with the patient, right? So when you listen, they will listen to you. When you don't listen, they're not going to bother listening to you. And remember, the older people tend to disregard younger people sometimes, right? And try and remember the personal details of the patient. If you remember, and this is something I do myself in my life as a consultant, I always remember the client's name. If I remember the client's husband or wife, or if they have a child, I remember something a little personal. Did someone come, which town they came from, try and connect. Maybe you came from the same town, or your father or mother came from the same town. Bring up some personal detail. Or did your son come to visit you yesterday? Did your father come to visit you yesterday? Did your wife or husband come to visit you yesterday? Things like this encourage the patient to feel comfortable with you, to show, and you're showing the patient that you have a genuine care in their overall health. Okay? This is also a time for you to sort of get to understand, auntie, okay tak dengan saya? You boleh faham bila saya cakap? Do you understand what I'm saying? Can you follow when I explain to you? Do you feel comfortable? Have I said anything wrong to you? Find out things like that, but don't dwell, not with every patient, with every other or every 4 patients, because you don't have time to get a general survey, from all of them. But do get some feedback. That's very important, because at the end of the day, the conditions at the hospital, will also determine how they react towards you, right? I remember one day when I was in one of the days at the hospital, the aircon was not working, and it was so uncomfortable. It was so warm. And then 2 days later, the aircon was working again, and it was freezing like an ice box. So all this will affect the patient's body, number one. Number two, will also affect the patient's psyche and how they react towards you. So please be careful about this, yeah? Now, This is something that I think we need to really understand. You need to explain to the if you're the houseman, you explain to them that it's not your job to explain what's going on with the results of the test, right? You can tell them some small things, but if you are one day if you are given the task for some reason as a houseman or you are an MO, I mean, don't rush giving information. Nobody wants to be told, oh, by the way, you have cancer, or by the way, your diabetes is beyond control, or by the way, we have to cut off your hand or your foot or your leg, or we have to do a brain surgery, right? Use language that is simple for them to understand. What's wrong with you, right? What's going on? Why they feel they have to do what they have to do? Is there any other option? Do they think there are any other options? Do you think there's any other option available for the patient to be able to choose? Then also tell the patient, well, at the end of the day, it's still your body and your choice. If you feel you need a second opinion, you should go and ask somebody else to be sure, because nobody likes to be out of control of their own body, right? They always want to feel that they have some degree or some level of control on their own life. So try and push for that, encourage them to also, at the end of the day, when they take control of their life, they're more likely to follow the medication protocols. When they feel they have no control, somebody has to give them the pill 3 times a day. Somebody has to make sure they eat the right food. Somebody has to make sure. So when you encourage them to take charge of their own life, what's going to happen is their adherence to the medical protocols that you have set for them is going to be better, right? So when you are delivering bad news, regardless of the level of bad news, that they're going to pass away, or that they're terminal or whatever, you have to be very careful and understand that if you're not capable of doing it alone, get a fellow doctor to stand next to you, or get someone more senior, or even the nurse can help you with it. A nurse who has created a rapport with the depending again on the protocol of what is allowed in the hospital, right? Of who can pass the information, the relevant information to the person in that, right? Now, you can also learn to be a bit more empathetic. Some of the things that you can do is do a simple blog, right? One time today, I noticed, this, for the 5 days that she's there, or the 2 weeks, some of them are there for weeks and weeks and weeks. Some people who are suffering from gout, for example, I've seen them in the hospital for 3 weeks, right? One day they're feeling down, one day they're not feeling down, one day they're in a good mood, one day they're not. You should observe, ask questions. Why? What happened today? You're so happy. I'm very happy to see you happy. What's going on? Then find out the good news and share in their happiness, right? There's also another technique called deep acting technique. Okay, when you push yourself to be empathetic, what happens is over the long run, people tend to perceive you, and when they perceive you as such, your behavior naturally skews towards being empathetic. It's almost like a placebo effect, that you have such a thing. So these are two of the things, and there's more coming up shortly, but these are things that you need to but I highly believe in the fact that you need to be an observer. Observe your patient, understand your patient, try and see what is going on right with them, or what is not going on right with them. Ask them questions, right? Again, within the limit that you have, and sometimes it's better to find that limit, the time to find all this out, because then you become a better doctor in the long run. Yeah. I give you an example for myself. I actually now, due to my diabetes, I've had not good control. Then when I was working in Kota Kinabalu, I had to go to a clinic because the diabetic wound that I had was seeping. And the doctor that I met there was so amazing that now I take the trouble to go to him, because I fly to KK every month to go and see my treatment. And since I've seen him in the last 9 months, my diabetes is completely under control. And it's amazing. Again, it's all about his bedside manner. He never treated me like I was a moron. He always respected me and always asked me, so Brian, do you understand what I'm trying to say? Then these are some things you should read when you have the time. So he always respected my ability to understand, and he always gave me an opportunity to be able to have some control over what I wanted to do. So think about that, yeah. So these are some of the other things that you could do: creative writing, blogging, drama, poetry, fiction. The ability to empathize. Now, many of you, I notice, come from a background where you come from schools where they're rote learning. You've never emoted as a young person. You've never given your emotions out. So it's good for you to understand some level of emoting yourself and be able to do this, right? So get yourself involved in something that you like so that you can also be able to show your emotions. If you are a closed up emotional person, you won't be able to understand the emotions of other people, right? Take part in communication skills workshops. Understand how this works. A good communicator is the best doctor. Please remember that, right? I believe that. Okay. Problem solving based learning interventions, interpersonal skills, patient interview, right? Patient interview, and this is something that I think is very, very, very important. And experiential learning with your fellow medical students. All of us are human beings, all of us have feelings, and agree that you're going to react honestly according to what, like, let's say we do a triage, there are three of us, I ask A, B ask C, C ask A again. And when we react to each other, we react honestly based and then give feedback of what you felt. Try and put yourself in a position where each of you have one kind of condition and you experiment with each other, but the answers must be honest. And you will find, surprisingly, that you yourself realize that what you haven't and or have done properly, right? Yeah. So these are things that I want to emphasize with you. Communication is king. Remember this well, and you will do it well. With that, I wish you all the best to being outstanding. What do you call it? Frontliners saving the world. And this is my email and my name. And if there's anything you want me to follow up, I'll be more than happy to follow up. Again, this is Brian Lariche from the Make It Right movement of Brickfields Asia College. Thank you very much.